each time to please speak on introduction and approach to obesity. The session to be chaired by Dr. Shobha Kaul, Mrs. Pragati Bansal, Dr. Mukesh Mehra and Dr. V.R. Sood.
So today we will be discussing science behind obesity. The reason for taking this session was that today we are discussing wellness, health, and obesity is another epidemic which in last 30-40 years has just taken a leap, and that leap is because of the change in lifestyle. The automobile revolution, the food revolution, the junk food revolution, and this COVID, all these things have added to this epidemic of obesity, and last 30-40 years have created a havoc. And 1/3 of Indians, 1/3 of Americans are today obese, and it is ever increasing. And if you take overweight category also, then 50 to 60% people are either overweight or obese. So obesity is a progressive disease. Let's remember, it's a disease. Obesity is a progressive disease impacting severely on individuals and society alike. It is widely acknowledged that obesity is the gateway. It is that door through which all other diseases enter, be it diabetes, hypertension, ischemic heart disease, etc., cancers. So what is the need? Why do we need to manage obesity? The reason is that we should not ignore that obesity is like hypertension, it is like diabetes, it is like cholesterol. You see, if you go back to 1940s and 50s, treating hypertension was considered wrong. Similarly, treating obesity 30-40 years back was not important because it was thought it is just way of life. But with modern medication, with our more knowledge about obesity, we have better ways of treating it, we have better ways of managing it, and we can delay the complications. It increases mortality, and we can decrease the mortality by treating obesity. So we all know that it is basically a lot of energy balance, how much you take, how much you spend, but it is not that simple. There are genetic factors, hormonal factors, many things. There's a big science behind obesity. There are different hormones, and these are, there are different anorexic hormones, hormones which increase appetite. Then there are gut hormones, CCK, GLP-1, GIP, PYY. And these days, the drugs that are being used for this are ones which are going to target these hormones, and GLP-1 receptor agonists and GIP agonists are the drugs of choice these days. GLP-1 receptor agonists such as semaglutide, and GLP and GIP agonists such as tirzepatide. And now another category of hormones which is drugs, which is GLP-1, GIP and glucagon receptor agonists. All these are coming up, which can lead to weight loss up to the level of bariatric surgery. And thus we are in exciting times, and I think next decade belongs to decade of obesity management. And once we manage obesity, we will be able to really change a lot of things, a lot of metabolic reversal will be there, and that is very, very important. I consider obesity is like Pandora's box. Poor Pandora opened that box and came out pain, misery, etc. And similarly, obesity leads to a lot of complications. There are metabolic complications such as asthma, NFLD, gallstones, infertility, subfertility, hypogonadism in males, PCOS, pregnancy complications, a lot of cancers, CVD, stroke, dyslipidemia, hypertension, coronary artery disease, congestive heart failure, pulmonary embolism, type 2 diabetes, pre-diabetes, thrombosis, gout, all these are complications of obesity. So you can see what a big villain is obesity, and we need to treat it. Then there are mechanical complications such as a patient cannot walk that much, physically he's not that functional, stress incontinence, knee osteoarthritis, sleep apnea, chronic back pain. And then there are psychological complications which are depression and anxiety. And what does weight loss do? Weight loss improves obesity-related health conditions. Benefits of only 5 to 10% weight loss can lead to reduction in diabetes, reduction in heart disease, improvement in blood cholesterol, improvement in blood pressure, improvement in severity of OSA, and improvement in health-related quality of life. Now imagine what 15% weight loss can do. 15% weight loss, as told in the morning in direct trial, look ahead trial, and so many other trials, that 15% weight loss can lead to diabetes reversal, can lead to hypertension reversal, can lead to stoppage of antihypertensives, can lead to cholesterol becoming normal, triglycerides becoming near normal. So we are into NFLD becoming normal. So that is why the stress has changed from glucocentric approach in diabetes, and even in general population, we need to manage our weight in a healthy manner so that we can reverse all these complications. So how do you manage? First is diagnosis of obesity. So we need to see whether it is apple-shaped obesity or pear-shaped. Apple-shaped is worse than pear-shaped obesity. Apple-shaped is the central obesity. The waist circumference for males is 90, for Indians, now I'm going to talk only about Indian parameters, more than 90 centimeter is obese for a male, and more than 80 centimeter is obese for an Indian female. Waist hip ratio more than 0.9 for male and more than 0.8 for female. Body fat percentage more than 25% for male and more than 30% for female is obese. Also BMI for Indians beyond 25 to 29.9 is grade 1 obesity, 30 to 34.9 is grade 2, and 35 and beyond is grade 3 obesity. So we need to see the BMI, we need to see the waist circumference. Please, I always say the way you measure pulse, BP, respiration, always see the waist circumference for all your patients. Also measure their weight and height and check the BMI. There's something called as normal weight obesity. We Indians have central obesity. I've seen patients with BMI of 23 with a lot of fatty liver. So we need to look into that aspect also. There is, there's something called as Edmonton obesity staging system. This is a very, very important system because there will be two patients of same BMI 35. One patient has hypertension, diabetes, CLD, CKD. Another patient has no complications. So staging of obesity is also very important along with grading of obesity. And how do you stage the obesity? Stage 2 is comorbidity has already set in. Patient has diabetes, hypertension, etc. It is stage 2. Stage 1 is when he has pre-hypertension, pre-diabetes. Stage 0 is no complications. Stage 3 is end stage. Renal functions have deteriorated, liver functions have deteriorated, NASH is there, and stage 4 is end stage CKD, CLD, etc. So also one more thing, whenever you're treating obesity, please go into the why of the obesity. If you will not go into the why of the obesity, you will never reach your target. So why has to be treated first, whether patient has any underlying psychological disorder, whether there is any other issue, hormonal issue, whether there are mechanical issues. So you need to find out the why before you go to what and how to treat, what to give. So first find out the baseline and then go ahead with what and how. Another very sensitive question is asked because our obese patients have undergone so much social trauma that they are not ready to talk. So we need to ask our patient very gently, politely, can we discuss obesity? If they say yes, then only you will go to assessing, advising, agreeing on issues that you can settle, and if needed, assist them to reach a right place, a bariatric surgeon, a psychologist, a psychiatrist, an endocrinologist, whoever you feel the patient would be benefited by. You need to form a team because it's a multidisciplinary approach. Obesity management is not that simple. So you will look into the hormones. You have to look at if there is any hypothyroidism, Cushing's, etc., etc. Look for these, whether there is any slowing of metabolism, there are any mechanical causes. These are 4 M's of obesity: mental, mechanical, metabolic, and monitoring. So pharmacotherapy, I think we are discussing later. Sleep is very important. 7 to 9 hours of good sleep is very important. Sleeping at right time. And in treatment, intensity and frequency of lifestyle modification is very important. Physical activity is very important. Behavioral sessions, intensive behavioral therapy is very important. And repeated counseling is very important. Weight regain is another issue. Patient loses weight and regains it very fast because it is a lifelong process. Whatever you're doing, be it exercise, be it calorie restriction, be it medication, it is a lifelong disease treated for the lifetime. Do not relax. The day you relax, you will gain it back. So we live on hope that next decade will see us manage obesity better. Thank you so much.
Congratulations, Dr. Naresh, for very comprehensive presentation in such a small time. Actually, you covered almost all aspects of it. And you rightly said it's a gateway of Pandora of disease, actually. It's a state of chronic inflammation. It is not diabetes, it is not obesity alone. It always comes with many more disease virtually affecting almost every system of the body, and also the diabetes, cardiovascular disease, obstructive sleep apnea and all. And as far as you have rightly said, it is you have to know the disease, you have to stage it well in time, and the prevention actually, which start right from the womb, what mother takes and how much time we actually breastfeeding actually the child is going to have, and avoiding all junk food and all. So management start right, and the preventive management start right at the time of I think conception. I think any comment from your side?
Yeah, as a practitioner, I mean as a dietitian, I would like to add on that, like you correctly said, that ask them first if they are willing to do that. So that's the most important question, because whenever an obese person comes to us, we need to take their consent on it. That's why they will actually follow you for a longer period. They would be more, you can say, a success story would be easier to get, and they would be successful in the longer terms also, in future as well. That's what I would like to say. Yeah.
You were right in saying that we have to find out why. And before that why, it is important, the main the challenges in front of all the medical fraternity and the diet counselors is to understand the mindset of people, their beliefs. And everybody, they will agree with me, all the diet fraternity, is that they will say, we don't have a problem, we are normal, we are taking our, we are leading a normal lifestyle, and we are eating normal food. So what is normal for them? And they say we are eating normal food as others are eating. So what is normal for them and others is different, because they are different individuals. So it is important to understand that the behavior modification is important. Drugs are going to help only if their lifestyles and their food habits are changed. Until they are not addressed, their root causes, as you said rightly, that is not addressed, they should know that. And second thing important, which is that obesity has never been taken as seriously. Behavioral modification and the lifestyle modifications are required in all types of diseases, because obesity is one which is, since it has not been taken as a disease, it is taken as a cosmetic problem world over. So it has to be taken seriously before it can be treated well by the people around us.
Thank you. Thank you so much.
Thank you.
Sorry? So that is what Dr. Rishi and others said, that we need to give them healthier food options, options which are not that inflammatory, anti-inflammatory food options which will have slow absorption, and so fruits, salads, green vegetables, and not give calorie dense foods. Calorie dense foods, what they do is they are rapidly absorbed, the sugar goes up, the sugar goes down fast, and the appetite comes back. So we need to give them foods which are high fiber diets and less in GI, less glycemic index.
And sir, just to add on the craving part, sir, counseling plays a very important role. So whenever we counsel a patient, or I would not call them patient, I would call them just a normal person with the problem of obesity. So when they come to us, we need to counsel them, and we have to be constantly in touch with them.
Intensive behavioral therapy, very important. Intensive behavioral therapy.
So that's a very important point, sir.
I request I request the speaker and the chairpersons to please come.
No, sir, Dr. Rajput.
Actually, just I want to add, we very easily discuss obesity, but it is one of the most complex subjects to understand. Now, obesity is also different type of obesity. Commonly what we are talking is metabolic obesity. There is another new concept of obesity, which is hedonic obesity. In our frontal cortex, in our limbic system, there are centers from where what you are asking. We eat for pleasure. We does not eat for hunger, or we does not eat for getting energy. And there is a person may have a pure metabolic obesity, a person may have pure hedonic obesity. For hedonic obesity, cannabinoid receptors and dopaminergic signals are more important than classical arcuate nucleus based concept of obesity. And there are persons who have combination of metabolic as well as hedonic obesity. Now, why drugs are failed? In past, whatever research has been done with the drugs, they are not designed to answer different type of problems for obesity. So the current era is where we can have drugs which can address even the concept of hedonic obesity, which is when we are eating for pleasure. So saying that eating lots of fibers, that does not give pleasure. So person will not eat that food. So whatever food we are eating, when it is giving us pleasure, it becomes a vicious cycle. So there are drugs which are now designed to break this circle so that the hedonic component of obesity is taken care of.
If we can
Thank you, sir. Thank you,
add
sir.
on the reasons of being craving for any kind of food. There are many reasons. It could be psychological, it could be physical. If a person is 10-20 kilos overweight, he will never have physical craving for food. It could be emotional, it could be psychological, it could be functional. So we need to understand what is the reason behind it first. And eating is one of the kind of overcoming, it's kind of a vice. We do it, some people they drink, some people they smoke, some people, we have to find out something else than eating. When we have to find out a reason out of all these kinds of emotions.
I request the speaker and the chairperson.
I think we'll now
We'll
call the
conclude
next
session here. Thanks for your patience hearing. Thanks, Dr. Naresh.